My name is Denai.
I'm Emily.
And I'm Bree, and today we're going to quickly demonstrate proximal range of motion for you guys, which is also known as PROM.
PROM is when the caregiver moves a patient's limbs through its range of motion because they can't do it themselves.
It is vital that we perform PROM after surgeries or during rehabilitation to prevent permanent stiffness, improve blood flow, and keep things moving.
Always make sure your patient is properly positioned and comfortable. Now, a few quick tips for your patient's comfort. Make sure to talk to your patient about what you're doing and ask them about their pain as you go. And also remember to move them frequently in bed so they prevent any bed sores. Now we're going to start PROM. One thing you need to know is always to make sure to start from the top of the patient's body to the bottom. I'm going to start with the shoulders, so I'm just going to support her by her elbow and her wrist and make sure that I'm carrying her weight, and then I'm just going to carry it over her head, and this is going to be flexion. And then I'm going to carry it back, and this is going to be extension. And we're going to do this 3 times. Next, what I'm going to do is I'm going to exercise the elbow. Whenever we're doing this, I'll show you on this side. You're just going to support the patient's arm, and you're going to take their hand all the way to their shoulder, which is going to be flexion, and then you're going to lay it down, which is going to be your extension. So this is flexion 1, extension 1. Always make sure you're not moving too fast and you're going at your patient's pace. And next, I'm going to do the wrist. So you're going to support the patient's wrist with both hands, and we're just going to go forwards, which is our flexion, and then we're going to go back, which is our extension, and then we're going to hyperextend, and then we're going to bring it back, and that's 1. And then next, what we're going to do is ulnar and radial flexion.
I'm going to start with this side and make sure it's like this, and then I'm just going to bend this way. 1, 2, 3, and the other way. 1, 2, 3. And the way I'm communicating with my patient is
Now we're going to do PROM on the lower part of the body. So now we're going to work on the knee. What you're going to do is you're going to tell your patient, now we're going to do some exercises on your knee. You're going to grab underneath her knee, and you're going to lift her up, and then you're going to use your other hand to support the ankle, making sure that she's not rubbing on the table any. Alright? And then you're just going to start with extension, lay the leg flat, and then flexion, you're bending the knee up. And then next we're going to work on the ankle. So what you're going to do is you're going to grab her. Always be sure to explain to your patient what you're going to do. And then you grab underneath their heel. And then you're going to take your other hand and hold on top of the toes. Alright. And then you're going to use dorsal flexion. Make sure you point the heel, and then plantar flexion. Alright.